Hello, everybody. To kind of jump right in and answer the first question, based on Module 8 lecture material, reflect on American culture and ways by which it enhances or harms health. And to answer this question, I referenced the Unnatural Causes video from the lecture material, and it identified the social determinants of health that are most at large. Um, and play the biggest factor in affecting health in American culture, and how it disproportionately affects certain groups of people. And from this, uh, I kind of determined that these social determinants of health and their effects on the health of our culture are not unique to America, but some other places around the world are doing things differently to help limit the effects of these social determinants of health. And I think the main thing is that needs to be challenged in American culture to help improve health is um, health education. I think by improving health education, we can improve the health of the whole culture by so much. Um, for example, even coping strategies for stress, such as providing health education on that, teaching that smoking isn't a healthy coping mechanism for stress, and then maybe providing some other examples of what healthy coping mechanisms for stress look like. And then, of course, the improved health education is not going to solve all the effects of the social determinants of health at play in American culture, but I do think that it would go a long way and make a really big improvement in the health of the whole population, and help limit the effects of American culture on the health of the population. And then for the second question, just kind of asked to give our final thoughts on cultural competency. And I kind of chose to spoke on what my main goal as a nurse and how to implement cultural competency into my nursing practice. And I chose to speak on that a little bit. And I came up with kind of three things to consider in my nursing practice. I want to treat all my patients and coworkers with respect. And also, I want to understand that there are outside factors affecting the health of patients, and really thinking about that while you're caring for them. This isn't just, oh, my patient with heart failure. This is, things at play that could be affecting how they manage that, and connecting them with resources to help them manage that. And then finally, I want to be able to continue to learn about cultural competency to become a better nurse, because I think providing cultural competent care is so important to being a good nurse, and that is my end goal, is to be a good nurse. So I would like to continue to learn about cultural competency so I can be the best nurse that I can be.